Morning. Thank you all for being in attendance. The hour of 8 a.m. having come and gone, the House Appropriations, Personnel, and Pensions Committee shall come to order. Clerk, please take the roll.
Kifowit.
Recording in progress.
Present.
Slaughter.
Here.
Reich.
Here.
Avelar. Davis. Fritz. Hernandez. Moore. West. Willauer. Williams. 8 members present, that's quorum.
Thank you, Madam Clerk. With 8 members present, we have a quorum. Today, we will have just one subject matter hearing on the FY27 proposals and requests from the Department of Central Management Systems. And they are currently at the table, and I will ask them to identify themselves for the record and then proceed with their presentation. Are there any handouts or anything you want for the committee? Okay, thank you. Please proceed.
Good morning. My name is Raven Devon, and I'm honored to continue serving as a director of the Illinois Department of Central Management Services. Thank you, Chair Kifowit, Vice Chair Slaughter, Minority Spokesperson Reich, and members of the committee. I thank you for the opportunity to appear before you today and for your continued partnership in strengthening CMS as an agency that serves as the operational backbone of our state. CMS delivers a broad spectrum of centralized services to support more than 80 state agencies, boards, and commissions, from hiring and labor relations to benefits administration, procurement, fleet management, property management, administrative hearings, and our work touches nearly every aspect of state government and ultimately the lives of Illinoisans. With the support of this committee, the General Assembly, and under the leadership of Governor Pritzker and his administration, we have continued to make meaningful, measurable progress in delivering more efficient, effective, and equitable services for the agencies we serve. When I stepped into this role just over 3 years ago, I committed to leading with a results-focused and people-driven approach. Today, I am proud to report that those efforts are yielding real, structural transformation across CMS and the state. The state of Illinois now has nearly 57,000 employees, which is the largest state workforce level since 2007, and the most diverse workforce in our history. We have made significant strides in addressing long-standing hiring challenges. Since 2019, we have reduced the average time to hire from 269 days to approximately 93 days.
Director, I need to interrupt you for just 1 second. I apologize. Clerk, please add Representative Fritz to the roll and Representative Davis to the roll. Thank you very much. Sorry, Director. Please continue.
Certainly. The average time to hire of 93 days represents a 65% reduction. At the same time, we have reduced statewide vacancy rates from over 14% to just 7.3%. These improvements are not just metrics. They translate into stronger agencies and better services. For example, we have supported the Department of Children and Family Services in hiring nearly 1,300 additional staff since 2019, helping them consistently meet critical caseload ratios of not more than 10-to-1 for the first time in over 5 years. At the same time, we are building a sustainable workforce pipeline. Through expanded partnerships with colleges and universities, we are creating pathways for young people to enter public service. We've also grown our community partner internship program to build the most diverse cohort to date. 52% of our interns have extended contracts or have secured full-time employment with the state of Illinois. Our recruitment efforts continue to meet the people where they are. Through our State of Illinois hiring events and job fairs, we are reaching new audiences and strengthening both recruitment and retention across the state. In benefits, CMS continues to manage a healthcare portfolio covering more than 470,000 lives. Over the past year, we successfully navigated the unexpected exit of Health Alliance from the marketplace, ensuring that more than 60,000 impacted members and their dependents experienced a smooth transition to new coverage. We also expanded access and engagement through a record 21 statewide benefits choice fairs and continued to invest in wellness initiatives like Be Well Illinois, which is improving health outcomes and reducing long-term costs. In procurement, we are advancing equity and economic opportunity. In fiscal year 2025, CMS achieved a 34.5% business enterprise or BEP program participation on dollars subject to goal, expanding access for diverse businesses across the state. Through vendor summits and outreach efforts in communities across Illinois, we are ensuring more businesses can compete and succeed in the state's marketplace. Our property management team is also delivering measurable value for taxpayers through strategic property acquisition and consolidation. We are reducing reliance on leased space and lowering long-term costs. The Jesse White State of Illinois building in Chicago has reached capacity, and the CMS Regional Complex in Springfield is now 50% full. The Surplus to Success program is also moving forward. We continue to prepare underutilized properties for community reinvestment, and environmental assessments have been completed at all 5 sites. In fleet, we've incorporated more than 1,000 new vehicles, reduced the average fleet time to 9 years, and reduced the average mileage of a vehicle to 86,000. Our goal is to get to the fleet average to 8 years and 80,000 miles. I'd like to note we've made progress toward this goal as the fleet age in 2023, at the start of my tenure, was over 11 years, and the average mileage of a vehicle was over 120,000 miles. At the same time, we are expanding electric vehicle deployment and building the infrastructure needed to support a more modern and sustainable fleet in pursuit of achieving the goals set by our 2030 carbon neutral mandate. We are also continuing to make progress in addressing legacy financial challenges. Through disciplined fiscal management and in partnership with the General Assembly, the state has retired over $5 billion in inherited liabilities since 2019. While we are proud of this progress, we remain focused on the challenges ahead. These challenges include rising healthcare costs, ongoing property maintenance needs, and a tumultuous federal landscape. In response, CMS is focused on adaptability, innovation, and data-driven decision-making to ensure we continue delivering for agencies and the people of Illinois. Today, I present a proposed fiscal year budget of $8.6 billion, a maintenance budget reflecting a modest increase of 7.3% and a net increase of merely 3 positions. This proposal underscores our commitment to responsible growth while continuing to strengthen the services that support state government. The progress we've made is not incremental. It is foundational. It reflects a stronger, more responsive, and more accountable CMS, and a state government better positioned to serve its people. I am deeply proud of the work of our team, and grateful for your partnership in making it possible. Joining me at the table today is CMS CFO Karen Pate, and in the room, we also have CMS Assistant Director Andre Williams, Chief of Staff Aaron O'Boyle, Carrie Wolf, Statewide Chief Benefits Officer, Eric Colon, Statewide Chief Asset Management Officer, Sarah Curley, Statewide Chief Administrative Officer, Corey Ann Golkovich, Chief Strategy Officer, Butch Stillwell, Chief Internal Auditor, Colin Brewer, Benefits Finance Officer, and Dana Stoger, along with Dana Stoger, our leader of Gov Affairs, and other members of the CMS team. I'm happy to answer any questions you may have.
Thank you, Director. I appreciate your presentation. I think if it would be available for members of the committee, they would probably appreciate all the successes CMS has done as well. And in looking at the numbers, it looks to me like one of the main drivers of cost is the group health insurance line item. And can you talk a little bit about our group health insurance cost, because it looks like that's the main driver of increases in your budget?
Yes, I mean, the majority of our budget is benefits. On an $8.6 billion budget, benefits is about 7.3. The reality is that there is medical inflation across the nation. We continue to combat some of those challenges. This is a result, quite frankly, the opposite bounce back of COVID. We continue to negotiate very vehemently with our insurance providers as they try and provide us what I would say unrealistic increases for premiums. We're digging into the business to make sure that we're understanding why things are increasing. We're also presenting strategies to mitigate our risks. We appear before COCFA next week. We've been in contact with them. We're looking to move the state to a self-insured model. That means that all of our insurance plans, we will only pay what we owe. So if Kifowit goes to the doctor, we're only going to pay what that claim was, as opposed to an HMO, a fully insured scenario where we don't know what we make on Kifowit, right? If you never go or if you go all the time, we're going to pay the same amount. And so given a coverage system of our size of almost $500,000, we believe that we can save the state money by paying Kifowit went twice. We're going to pay for twice instead of paying for a fully insured model where they may assume Kifowit may go 5 times. And so we anticipate with the coverage, with the passage of that, we'll be able to save the state about $40 million a year, and that'll start in fiscal year 28.
No, I appreciate you putting that on the record because when I was with the city of Aurora, they were self-insured and they were able to mitigate costs and they were able to manage costs a lot better than going through the intermediary,
Sure.
for lack of a better word. And there's been many reports that I've seen over the years as a General Assembly member how sometimes these managed care plans aren't as cost effective as we want to be in turn. And as you know, we've as a state have looked at things that like step therapy
Sure.
that doesn't work and other things that don't work. So what is the timeline for the this transition to self-insured? I think it's a good idea, and I think it's going to save us a lot of money. But
Yeah. Thank you, and I really appreciate you saying that. So we've looked at states around the country. Some states are all self-insured. Many of the larger states that are more complex, like Illinois, do have a hybrid, but the vast majority of their folks are in self-insured, and that's where they are saving money. Right now, today, so we are going to have to. We still anticipate that people will have choice. You will still get to have a high spend plan if that's your position, an HMO or an OAP. But we had to re-procure for our HMO plans because they were fully insured. And so they're currently on the street right now. So we anticipate being able to complete that RFP process before the end of the calendar year. We also hope, and the plan is, there are a couple big players who are not in our pond. They left us during times of we weren't paying our bills. And so we are hopeful that will also drive more competition because we anticipate after 5 years of we've paid all of our bills. We've shown that we are capable of fiscally managing our responsibilities. That the more interest will come into and pursue our business. So by the end of the calendar year, we should have all of the non-self-insured products re-procured, and we'll be ready to go for fiscal year 28.
No, that sounds great, and if you can keep us updated on that
Absolutely.
transition, because oftentimes I can't speak for other representatives, but oftentimes there's discrepancies, there's really, for lack of a better word, disingenuous decisions made based on profit more so than patient care. And many representatives that in residents in my district have had course of care canceled in the middle. And one of the things that I've always stuck with me is that we had to pass a bill to provide hearing aids for children because the insurance company didn't want to give a hearing aid to a child except for once every 3 years. And those of us that have children know that a 1-year-old is much different than a 4-year-old. And just to deny children the ability to properly hear is just astounding. And so making sure that we are receptive to the employees that give so much to the state and giving them proper health care, I think, is very important. And
Chair, if I may, we also believe with this move, because we'll get more claim data, we will be able to be more responsive to identify needs of the members. Whether or not it is, like right now, we're doing a skin cancer screening with limited because of kind of the way our structure is today. But we're doing skin cancer screenings with state agencies, our colleagues who work outside a lot more. So we've done it at IDOT, we've done it at AG, we just were at EPA last week, and our hope is to identify challenges early so that we are able to do more responsive with the claim data to understand where we're having challenges and go out and deploy resources to make sure that we are able to catch it early and be responsive so that we're cost avoiding in the future. If we can catch it early, then of course that's better than late, and also improve the quality of life for our members.
No, that's great. And I do think, as I said, I've had experience with self-insured back in the state of Illinois, with the city of Aurora, and it works very well for the employees. I'm going to follow up, and then I'll pass it over for questions. Years ago, our youth in care were taken out of, pretty much a direct pay model into an MCO model, and I've heard that with mixed reviews. Does this affect any of the youth in care that we took off of direct pay onto the HMO process?
No, this is only for state employees,
Okay.
retirees, their dependents, and then whatever municipalities may be a part of our plan.
I just want to put that on there for the record. All right, the chair would recognize Representative Moore for a question.
Good morning, Director.
Good morning.
So just a couple things, just circling back to the self-insured. So I was with the city of Quincy and we had a self-insured fund. It worked really well. One of the things I would just caution you is to really make sure that you can track the reason for expenditures increasing because of certain claims that happen. And so as you have an aging work population, you may have cancer rates that raise one year that you maybe didn't have the previous year. And so if you don't have a good fund balance, then you're going to have to come back to us and ask for more money. And so I would make sure that when you go through that process, you have a fund balance that can meet those demands. And we actually have at the city, it wasn't under my administration, they left the self-insured. It actually cost them a lot more money. And so I think it's a good direction to go as long as you can have those fund balances in place to to protect you against claims that may be surprising one year that you didn't take into consideration.
Can I invite you all to COGFA with us next week?
So I just have a couple other questions. So you mentioned about certain buildings being at capacity workplaces. How much percentage of your workforce is still work from home versus in office?
Sure. So as you all know, state government loves a pilot, and we remain actually in a pilot with our labor partners as it relates to hybrid work. While it started in 2007, that agreement, obviously it really went into force, I would say, during the COVID pandemic. And every state agency, every agency head has a modicum of decision-making as to whether or not their workforce is bureaus are working remotely, hybridly or not. So I actually don't have that data. We have collected information from agencies to get an understanding of the need for space, because we know that there are a number of bureaus throughout state agencies who are hybrid, but I don't have a concrete answer for you, and I would not be able to do that. I'd have to get the information from the agency heads.
Okay. So you mentioned the Surplus to Success program. We've got a site in my district for that. Do you know how much of the $300 million appropriation has been spent so far in that program?
Probably less than about $2.5 million.
Okay.
Go ahead.
Okay. And do you know the timeline? So you said a number of environmental studies have been done and completed. So for these communities that are asking, so how long is this going to take? And what's the process for deciding how the $300 million is spent in each community? Sure.
Thank you. So the legislature approved the $300 million last year, July 1, and we got moving right away. All 5 sites we've completed phase 1, the phase 1 environmental assessment, along with phase 2. Phase 2 is a little bit more testing, actually going into the ground to say how dirty is it or what are the challenges. We just completed all of that late last month, early this month for every single site. And so right now we're working with DNR and the state HIPPO process, the State Historic Preservation Office, to assess any sort of historic value to all of the sites. Some of the sites, as you know, they had cemeteries that also is part of the HIPPO process. And so they get to provide the outline about what are our next steps. Presently, we are getting ready to go out to to many of the trade associations around the state and in the areas to let folks know that this work is coming. If you're asking for when we expect shovels in the ground to start true demolition, that will probably be, we're still about a year away from that. We need to do the environmental assessment. We have to procure an architectural firm or team to design the demolition, an environmental remediation process, and then we would actually procure demolition, a design build, maybe a couple design build teams to actually execute the demolition and haul off site. We have met with all of the local leaderships that have sites to discuss what comes after this. The reality is this is the state making good on a disinvestment. And so the future of the site will really be largely left to the municipalities in terms of what their needs are. They're like in Rockford, they're very clear. They want housing. That is how they want to satisfy the need. In Kankakee, they're like, well, we want a little bit of housing. We want to build a manufacturing center. And so we have met with the municipal leaders in all of those areas to start those conversations. And we keep them up to date as we make significant progress. They are the first to know, and we have quarterly meetings with all of them to bring them up to date, not just on their property, but on the fuller lens, so that whatever Rockford is doing, maybe Lincoln can consider.
Well, we have to take care of Rockford.
It's not because he's right here in my right eye.
So our local leadership at Jacksonville has been very complimentary of your team and the meetings. I appreciate that. The couple more questions and then I'm done. So the $300 million, when we think about the sites, is the appropriation going to be divided equally between all sites or based on need? Because some sites have more acres than others.
Yes.
What's the breakdown going to be for that?
So we don't have a strict breakdown. We did when we put together the number, we estimated how much we thought each site would cost. But I was very strong in the administration agreed. We didn't want to assign a cost to each one and then be locked in because the reality is Jacksonville needs more than every other site. Jacksonville is the baby Chernobyl of all five.
Right.
They've got a power plant. We've got a filling station across the street. We've got not one, not two, but 3 cemeteries, and I don't know what else we're going to find. I think there's some underground storage tanks too. So the idea is that all 5 will take out of that 300 million. Now, the needs in Shapiro and Kankakee, much lower. They will need probably less than $5 million. We already know that. So that means there's a lot more for the other 4. But we have not assigned the $300 million for the full 5. So whatever it's going to take, within reason. Now, of course, I don't want to overpromise here. If it says, Jacksonville's going to take $100 million. Well, that's a decision above my pay grade,
right.
But I would say that maybe that's not the best use.
I certainly understand that. And so I have one more request because I had a colleague of mine reach out to me and just this last week who has one of these sites and his or her districts and said, who do I reach out to because I don't know much about this. And so,
Sure.
I gave them who I thought. But if you could, when you have those quarterly meetings with the local teams, maybe invite our teams to attend or maybe provide quarterly updates to the reps. Not that, we definitely don't want to be, how do I say this? We don't want to nickel and dime you and be about
Sure.
that. But I think this was great information that then I can take back to the city of Jacksonville.
Thank you for the feedback. We'll get right on it.
Thank you.
Thank you. Great questions. The chair will recognize Representative Williams. And just for clarification, Representative Davis is not in attendance, so just to make the record correct. So Representative Williams.
Good morning.
Good morning.
I was looking at the personnel statistics. It says 93 days to hire. So what's the process?
The process to hire?
Yes.
We have it. Well, we broke it down into 12 large steps, but really it's about 400 steps. First, I'd like to say we can follow up with your office with the hiring process so that you can have an understanding of what it takes. It's a blended process between the agency that needs the person as well as CMS. Everything starts with the hiring agency, and then we follow the process as prescribed largely by our labor agreements with our labor partners. And a need is routed through the agency very largely at a high level. A need is identified, it's routed through internally, electronically through the agency to one, make sure the job description is right, it's funded, they have their internal approvals, and then it comes over to CMS to ensure that the job description is appropriate and we can approve the posting. From there, there are a number of internal steps that occur. We post to our website. There's also, I think, even before that, depending on the role and the agency, we'll work to identify if there's a way that we need to do some special recruiting, if there's special requirements for those roles, and then we will make sure that as a state enterprise, we're pursuing recruiting in the right ponds to get the right folks. It's posted. It does take a while once an applicant applies. Full disclosure, they may not hear anything. It might be dead silent for 60 days or more. We are working on fine-tuning our HCM system to be able to proactively tell applicants you're still in consideration, don't go anywhere, or just let you know, hey, we're still in the process. Right now our system is not designed to do that, but imminently, probably before you get out of session, we'll be able to do that. And then once an applicant is received, once the application closes, whether or not you have to do grading, depending on how many. For the vast majority of entry-level roles, we get hundreds of applicants, and then we have to apply depending on how many roles are available. There's either a lottery to say, all right, well, we're going to assess these next 15, and that's a hard reality. I totally understand what I'm saying here. I get 200 applicants, and there's a lottery. So even the fact that you can even apply and qualify, you still may not be looked at. And then depending on the role, there are either interviews, assessments, and then we go ahead and execute the hiring process. That's it at a very large, high level. That's typically for entry-level jobs. If you're talking about some more specific or personalized or specialized roles, process may differ a bit.
So I see that the Caucasian and your personnel statistics, Caucasians are consistently getting hired more than African Americans. In fiscal year 21, you had 590. You went up 21 hires of Caucasians, 5 blacks. 26, you had 18 Caucasians, 9 blacks. Tell me, how does that discrepancy, how does that apply? What's that about?
Well, it's complicated. It didn't just start with any of us. It's about where roles are. You look at where are some of the roles, and then you look at the demographics of those communities. It's going to be very difficult to get potentially super diverse candidates for roles in DuQuoin, Illinois. That's just the reality of it. That's a fact.
What part of Illinois you said?
DuQuoin.
Say it again. I'm sorry. DuQuoin.
DuQuoin.
Okay.
That is not a very diverse area. And so it is unlikely that you will get a lot of diverse candidates in that area. I can tell you that unequivocally, CMS has not stopped its commitment to ensuring we have the most diverse workforce in the state's history, whether or not it's over 150 events throughout the state. Full disclosure, I view diversity in all the ways, whether or not it's geography, it's ethnicity, it's experience, it's ability. And we are also partnering with community partners to say, where are your qualified candidates? Because we want the most diverse candidates from the widest pool. Today, we have almost 23% of the state's workforce is African American. That's the highest it's ever been. We have we're still inching towards 8% for Latino, and we've added hundreds of Asian Americans to the state's workforce in the last 3 years. I'm very proud of those numbers, and we'll continue to identify diverse candidates, the best candidates from the most diverse hiring pools.
So what's your outreach to the black community to let the black community know that CMS or IDOT is hiring? I mean, tell me your outreach plan. Do you all do any outreach other than just posting something on your website and people still don't know how to go about reading? So tell me your outreach to the black community to let the black community know that CMS or IDOT is hiring.
Well, Representative, as you well know, we try and have hiring events in black communities. We've been working with your.
I didn't know that. go ahead.
We've been working with your office to try and finalize an event for a few months. We've worked with your colleagues. We are in communication with the Illinois Black Caucus Foundation, whether or not it's the Urban League. We're at the Bud Billiken Parade. We've been in Vice Chair Slaughter's district. We are wherever the people are. We have a great relationship with City Colleges of Chicago, looking to create some different pipelines for various positions at the state. We have also identified a number of smaller community partners, whether or not it's through our community partner internship program. We are in relationship with all of the communities of interest to make sure that our workforce is diverse, and getting candidates. And not only have we gotten them, my focus today is on retaining them, making sure that we have an environment that's ready to receive a diverse workforce. And I'm super excited for the day we'll be able to finalize our event in your district, hopefully in the near future.
Me too. But Tim, do you all outsource the contracts? Do you all do a lot of outsourcing the contract opportunities to in CMS?
No. So 3 years ago, I asked this body for money to build out recruiting. CMS didn't recruit any before then. It was left to the agencies. And there was no way we were going to get the numbers we were without actually owning recruitment. We own a lot of the hiring process. So we own recruitment. We have CMS state employees who actually live on the road, who are recruiting on behalf, not just of CMS, of all the agencies. So we are in communication. DCFS, if they need social workers, we're hitting the pavement for social workers. If IDOT needs highway maintainers, we're hitting the pavement for that. We are in constant communication with our colleagues and the HR teams at the agencies. Whatever their need is, our recruiting team. Now, I want to also acknowledge they do have recruiting as well. The agencies do. We just have we're an extension of them. I want to acknowledge our colleagues at DCFS. They recruit their tails off. So does DVA.
Thank you, Ms. Raven.
Thank you. I do want to follow up on some of that subject matter. When you get these applications in, how are they screened? Are we using software to screen these applicants? I'm looking at more for diversity on the back end than going to job fairs, because if there are barriers to employment that are intrinsic, that are inherent, that are not identified within an organization, such as minimum qualifications that are kind of unobtainable sometimes for certain communities that might not be able to go to college, that might not be able to obtain very high entry level, which systematically then discriminates against certain individuals than others who do have a better access, for example, community college and stuff to that effect, notwithstanding specifics, like you said, social workers and stuff like that. So on the back end, behind the scenes, how are we screening people? Are we using computer software? Are we using individuals? And then do we have an after-action report, such as we got, let's just say 50% of applicants are minority, but we only hired 2% of them. Are we looking at after-action reports on why was 48% of minority applicants not chosen? What can we do as a state to increase that opportunity? And so I see you have your experienced individual at the table, and so just introduce yourself, and if you could please extrapolate, that would be wonderful.
Before I turn it over to Sarah, Chair, thank you for the question. I want to say a couple things. Senate Bill 2228, which was passed in 2023, they tell me it's a public act now. I'm supposed to know the public act. I just know 2228. We did a number of things. Aside of removing some of the arcane steps that they were barriers to access for lots of people, certainly diverse people alike. We also we took over that time and to get ready for our HCM system, our new software system, we looked at every single requirement. So we got rid of tests. We got rid of there's no reason for this role. You don't need, there are certificates now that make more sense. Or you just never needed a degree or whatever the hours were. So without question today, every role at the state of Illinois has been touched in the last 4 years for relevancy and for requirements. That was a lower bearing exercise that has paid very much so dividends as it relates to all sorts of candidates and certainly diverse. But there were more parts to your question that Sarah is much better adept to answer.
Right, and on that line, do we have a data tracker to show before and after with regards to that improvement?
Good morning. Thank you, Representative. My name is Sarah Curley. I'm Chief Administrative Officer at CMS. All the people functions roll up, enterprise people functions roll up through me. One of the biggest changes that we've seen, so in first question, how do we screen? We do not use software, we do not use AI. We have highly trained HR professionals that review applications against minimum qualifications as well as preferred qualifications to identify the most qualified from among those minimally qualified for roles at the state to serve the people of Illinois. Next, when you talk about after action reports or that kind of data-driven analysis, the lengths we've gone, that we have come in the last 5 years about access to information about people who are actually applying for specific roles that are being filled, their demographic breakdown, how they work through the hiring funnel, all of those things is we have come a generation in 5 years. We previously did not have access to meaningful information to make those assessments. We're certainly not perfect. We continue to work on drilling down in that space, but we are at a place now where we can look and see. One of my first, the diversity and inclusion team rolls up through me as well. And we have the employment plan advisory councils where we have gubernatorial appointees that are experts and advocates in various communities that help advise us, both to Director's point, where to meet candidates, what barriers constituencies are facing, how to overcome them. And at the very first thing, one, we had to remove barriers. Two, we had to look and see if there were, to your point, if there were disparate impacts throughout the process that we couldn't previously see. And one of the best news of my career was that when we got that initial data, we did not see huge disparities in the manner in which applicants moved through the hiring funnel. We did learn some things. So, for example, we have done a really good job educating the African American community to apply for every job they think they could possibly do. So we have very robust